co-founder of the Together Declaration, Alan Miller. Alan, take this the right way, I hope, but you were a very regular contributor on this news channel for a while. I've seen a bit less of you recently, and that's a cause for rejoicing, but that's not personal.
No, we should be rejoicing at the fact that we've now managed to ensure that both vaccine passports and vaccine mandates have ended. But there's a but, isn't there? Because then there's 40,000 people who had to leave. This should never have happened in the first place. It should never have been in place. They need to be brought back in and compensated for the time they've missed. We've got a care home crisis. There's also another big but, Colin, which is that all the stuff that Together and the Together Declaration is campaigning around has always been around rights and freedoms and open debate. And we've got a situation where, whilst we're told the Coronavirus Act will end, we know in Scotland that emergency powers have been continued. But whilst we're told the Coronavirus Act will end, we're now seeing that at least two of the measures will be retained. Some will go into the Public Health Act, which was used for lockdowns, not emergency powers, and the other into the Police Crime Sentencing Bill. And we're going to keep campaigning to ensure the public has its voice. We now have a really big base of signatories, over 260,000. And we're going to keep campaigning to ensure that our rights and freedom, things like the online safety bill as well, and around these issues. And in fact, tonight we've got a debate on the Human Rights Act and the Bill of Rights. I think the point is that when these measures are imposed, often without thinking, sometimes due to modelling, and we're treated with contempt as the public and workers, we need to ensure that the government steps back now and does not do that again. And that's also why we're having a public inquiry together to ensure that we have a full reckoning of what's happened in the last 2 years, and that we don't again have a situation where the public is sidelined and parliamentary scrutiny is put off the table. We can't allow for that to happen again. So perhaps you're not rejoicing too soon. You might be hearing a bit more from us.
Yeah, I know what you mean. Alan, this is my shameless plug. I had an hour-long conversation on tape. Well, not on tape anymore, but you know what I mean, recorded this morning with Lord Sumption, Jonathan Sumption, former Supreme Court judge, who at times, as I'm sure you'll agree with me, felt like a voice in the wilderness, didn't he, in the early days of COVID, some of the points he was making. You mentioned the Public Health Act, and he's got some very strong views on that. We'll be putting that up as a podcast in the next few days, and I recommend people who are interested in the intersection between the law, COVID and government. He's absolutely fascinating on that subject. Just in terms of the human dimension to this now, Alan, those people who were threatened with a big stick in care, and I don't know about you, but I felt very strongly, particularly interviewing, highly credentialed doctors who made the point to the government, we're not going to be jabbed. They were very networked. They had great powers of persuasion, but they were not, and they were listened to. And I just felt they were handled differently from those poor care workers who maybe didn't have those networking skills, presentational skills, call it what you like, to make their case. And some thousands lost their jobs, right?
Well, I mean, one of the things is representation is really important and having a voice. Care home workers were also presented with the really sharp narrative that you're, putting vulnerable lives at risk and danger. Although if we know that transmissions were not prevented from the vaccination, and they were there to protect individuals taking it, particularly those vulnerable, very old and with comorbidities, then that wasn't the case. But yes, I mean, as with many things, it's always the voice of the public, being able to represent yourself, the fact that unions just didn't do anything. And that's why with Together Declaration, working with NHS 100K and others, Workers of England Union, we've basically got a situation now where people do have a voice. We're going to make sure that it's heard continually. We know that elections are coming up. We promise people that depending on the MP's position, people's votes would depend on it. And we still have a lot of outstanding issues that have not gone away, like the measures coming in, the Police Crime Sentencing Bill, online safety bill. We need to ensure that the public does not have our freedoms encroached. When everyone quite rightly is talking about freedom around the world, these are not vacuous terms, and we should absolutely applaud people elsewhere that fight for them. But in the UK, there are some severe issues that are still impacting us, and Together Declaration is going to insist that we can still have our voices heard. And the point about Now, what's different to then is we are going to keep very vigilant eyes on anyone who's being pushed or coerced to do measures that they should not be, and we're going to have a voice of representation that's going to be ongoing. People will hear from us in the May elections and ongoing. We're not standing, but we'll be making sure MPs hear from constituents, and we now are not going to be sidelined again.
Miller, we'll talk to you soon. That seems pretty likely. For now, though, thanks very much indeed for your time. Thanks a lot. Annabel Denham alongside me listening to that. I read, just before I came on air, Annabel, there's a care home association conference going on in the UK right now, and there was a quotation I saw from a senior care home manager who talked about the COVID period and how he saw customers, patients, I'm not sure exactly what you call them, people living in care homes, elderly folk, losing the will to live, no contact with their loved ones, and the phrase he used was they simply lost the will to live.
But it's hard. I mean, it's hardly surprising. And 2 years have passed since the really acute, or nearly 2 years since the really acute care home crisis, when a lot of people were discharged from hospital and sent to care homes, and COVID was just rampant.
Sent to care homes, but then denied any contact with family.
And denied any contact with family. And you know, it's just a terrible way for a society to treat its elderly. It was obviously a panicked move at a time of complete emergency. When it comes to the vaccine mandate, I mean, how fortunate really for the government that Omicron came along when it did, because it had taken itself so far down this vaccine mandate road that it was going to be very difficult to row back on.
Do you think they always planned to do the U-turn?
It surely was inevitable. As we know, 40,000 people have already left the sector. That number would have increased dramatically. There would have been acute staffing shortages, at a time when social care is in dire need of reform across the board. And there obviously is this staffing shortfall, and there was always this stick approach to staff in health and social care not getting the vaccine. It was never a carrot. There was never, to me at least, seemed to be an effort to understand why it was that these people weren't getting the vaccine and attempt to educate and communicate with them on why they should.